Hello, I'm Fatemeh Youssefi. I work as oncology certified nurse for many years in the field. Um, kind of about 24 years that I've been taking care of the oncology patients. Um, I have worked in the different spectrum of our oncology world, infusion nurse, clinic nurse, as some sort of navigator, which the word navigator was not existent in the past. So this is my pleasure to be here and talk about the survivorship and the quality of life. In our previous series, we have talked about the health literacy and providing the tool to our patients. And in general, what some of the barriers that our patients with the GI cancer experience, and specifically we talk about colorectal population. We know that if these patients receiving chemotherapy, few of those regimens contain adverse complications and side effects that can be tough on these patients, such as cold sensitivity with the full FOX regimen, which is oxaliplatin, 5-FU, leucovorin, or fluorosis leucovorin, and neuropathy that exists as a side effect. So as oncology nurses, it's extremely important to assess the symptoms. Our patients see the providers, and then they go to some sort of the infusion areas, whether institution has an outpatient clinic or they do this as a kind of tag along to the inpatient area. So it's all important to ask the patients and reinforce the teachings to make sure that these patients are at the manageable symptoms. We don't want the symptoms to be worse than the disease. We don't want these patients, as a result of having mobility issues, to fall and fracture the hip during the treatments for the colon cancers, colorectal cancers. So it is important to provide them that quality of care in a metastatic regimens. Again, there is a lot of in a literature that if the patient needs to take break from the treatment, it's important to communicate their concerns to the providers and encourage the patients to have an open dialogue with their providers to see if they can take a week off for issues such as the wedding of their children's or retirement party or any of those milestones in their life. So beyond just the regimen and treatment, is important to look at the patients in survivorship as a whole, not just as a disease that they're experiencing. Again, as the individuals who are diagnosed and receive treatment below age of 50, important to talk about if they are experiencing radiation. We talk about infertility if they're younger in that age group. We know that most of in the population is in the society as a whole, individuals wait longer to have families. So if they are diagnosed, we have to make sure that they do have per NCCN guidelines the infertility counseling, if that's they choose the route to go. Again, we have to be inclusive in all of our cares. We know that there are some health disparities, the racial inequalities, that the access to care sometimes comes into the questions, and then the survivorship basically is not on this individual have to take off from work. We have to encourage the worksite health and make sure that if all this paperwork that needs to be done for the FMLA, for family medical leave, that we expedite those. These are a very important component to the survivorship of these patients, to make sure that they have their continuum of their job, that they have to go back, and you're hoping that for them to get better, to go back to work and to maintain some sort of quality of life. Again, one of the important conversation that as oncology nurses and in the whole as oncology field we need to have with our patients to revisit their goals of the life goals, and to make sure that if they need to modify it, to visit it, to see what becomes important at that point for them and encourage them to attain to that. we cannot go on again and talk about the colorectal if we felt about emphasize on financial toxicity, that these patients going to have medical debt coming out of for the treatment. So help them to find the resources, get our wonderful social worker involved to see if there is any means and resources available for them. Yeah, so it's important to, as an oncology nurse, to be holistic, provide a holistic care to our patients rather than just disease specific.